6-year-old female patient with progressive, now severe to profound hearing loss. This is her right-sided cochlear implant.
So they're drilling a hole in this bone.
We're first performing the mastectomy and canal all up. Mastectomy is performed to expose the horizontal canal of the incus. We're now performing a facial recess to gain access to the middle ear from behind the posterior tympanotic approach. The recess is bounded by the chordotympany nerve anteriorly and the facial nerve posteriorly, and the incus buttress superiorly. Here we're widening the facial recess by taking down the prefacial bone to expose the round window niche, seen deep through the facial recess, as well as the promontory of cochlea.
Okay, now they're actually drilling a hole in the cochlea.
Smallest diamond burr to gently open up the cochleostomy to accommodate the electrode at its
And there's the electrode.
This is an off-stylet insertion using the advanced bionics helix system, where we can gently insert the electrode off-stylet into the scala tympani. And here in this right cochlea, we will be able to achieve a full insertion. Gently remove the insertion tool off of the electrode. Once the electrode is fully inserted, and we see that it is fully inserted at the cochleostomy, and then we seal the opening with some temporalis fascia.
So they've got some, they're doing a muscle graft to hold this part in place in the cochlea. And then this is just all the rest of that.
How long does that surgery take?
For one implant, it's about 2 hours. And it's an outpatient surgery. So they come in the morning. Although some surgeons, if the patient lives more than, I think Dr. Stafford's rule is if they live more than 300 miles away, they do have to stay overnight, just in case. But if they live closer, then they come in the morning, they have the surgery, and then they usually go home the same day. And once the electrode is in, that's the surgeon's part, and then the audiologist will actually go down. They'll take the computer, because we program these implants using a computer, and we'll actually hook it up to the computer that we're going to use when they're, when they come back to see us, when they get mapped, when the actual external piece gets programmed. We use the same computer. We hook up their device to it, and then we make a couple of measurements before they, well, sometimes before they close. Some of the surgeons like to close first. Some of them like to wait until after we've taken our measurements. But we'll actually go to the OR. We'll hook it up. And two things that we're looking for is, one, we want to make sure that the nerve is responding the way that it should. The other thing we want to check is our impedances. Impedance is basically just resistance to the flow of that electric current. If your impedances are too high, you can actually get, it means that you have to put more current in there to stimulate the nerve. Unfortunately, when that happens, the current kind of spreads and you can actually get facial stimulation. So that's one thing that we want to make sure is not happening. So two things that we want to know before they're done with surgery. So we'll do that part. Sometimes it takes, we're in and out in 10 minutes. Sometimes they call us way too early and we're just hanging out there, which is fine. OR is actually kind of fun place. It's not tense like it is on TV. And they're always in the dark on TV. ORs are not that dark. They're soft light. So these are just a couple of images of what the implant looks like once it's in there. This one, I'm actually not sure this is a patient. I think this might be a temporal bone, like from a cadaver. But still, you can kind of see.
Yeah.
But there's your electrode in there, and then that's what the rest of the device looks like once it's in. Of course, because you have a magnet, once you have this in place, you can't have an MRI. You can, you can, there's a surgical procedure you can do to remove the magnet. We just don't want to have to do that a lot. But X-ray is fine, CT is fine, once you have that device in. So they have the surgery, and then 2 to 4 weeks later, they come back, they visit with the surgeon, they make sure that the wound is healing up nicely, and then if everything looks fine, then they'll come and see audiology, and we basically take it from there. first year, we see them a number of times. We'll see them for their initial activation, which happens again 2 to 4 weeks after they got their implant. And then we usually see maybe a month afterwards, 3 months, 6 months, 12 months, just because a lot of times you do need some adjustment in the beginning. This is a completely different kind of hearing. It's hearing electrically instead of acoustically. So it takes a long time. It takes 12 to 18 months for your brain to really be performing at your maximum level. For most people. I did include a video here of one of our patients who, I hesitate to even show you this because it doesn't always go this well, and she was performing so well right off the bat. I do have that video. If this is her initial activation. I don't remember her whole story. You can kind of hear from her voice that she clearly has had a lot of hearing loss for a long time. She has some of what we call it deaf speech, which I think probably everybody's heard. It's a very characteristic way of speaking, and it's just because all the sounds to them sound very muffled, and so that's the way they speak. Is they speak, their speech seems to be kind of muffled. She's pretty